This brings really good memories
Yes.
of you and me late at night
Yes,
scoping.
scoping at the harbor.
Yes, it does. It certainly does. But let me introduce first Dr. Woojan Kim, who is the best at everything he does. And we're so lucky to have him. We're particularly grateful. This year he went with us to Vietnam and did amazing endoscopic resections in front of lots and lots of people. But when we do these things, and we deal with bleeding a lot of the time, and you're a very patient person, and I'm not so patient. When you go in and there's a lot of clots, what do you do?
Wow, first, thank you again for AW. This is a tremendous honor to be here this year. And Dr. Riker, we go way back as we were fellows. I was a general GI fellow. We've seen a lot of bleeders. And as you said, as a fellow, or we go in and see this clots of blood, and this is not uncommon. And what do? We can't even see the bleeding source. We're just anxious and nervous because it's bleeding. So what do we do with all these clots of blood that we see?
Especially at 2 in the morning.
Yes, ma'am.
Yeah, the patient runs low at 2 in the morning.
Yeah.
Yes.
And in the ICU or in the patient inpatient floors, it's a very nervous situation. And so we here have this Neptune rigidizer. So we all are aware of the rigidizer Neptune for both the colonoscopy and upper endoscopy, and even the RCP for those tortuous anatomy, straightening the tortuous lumen with the rigidizer. But here we're using the upper rigidizer, and we have attached this special clot remover, CR, to able to now help us suction those clots and then be able to access the bleeding source.
And you're actually using just a regular upper scope?
Yeah, just a regular upper scope.
Not like this big,
no.
I was trying to find a
yeah.
politically correct word for that,
Yeah,
like
yeah.
that big thing.
The super suction or any of these, like, you know.
Which are really hard to retroflex, maneuver.
Yeah, and so then, and also the patients can't tolerate it. We're not usually in the operating room or general anesthesia. You got to go in there quickly with the regular upper scope and try to stabilize and see the bleeding source. So this is perfect for that purpose where we go in. So basically, we have this rigidizer going in there and then attached to the CR special suction. As you can see, this is, I think this is just a regular or the Bravo suction, but it's able to set up at 350 here and is able to get us the clots that we need. So
shall we try?
Yeah, so we got the scope in there. First you can see it goes all the way through here like this as if you were using a regular straightening part. But then for this purpose, we're gonna pull it back and you can see the cap on the video. And we're gonna go in there. You'll see how strong the suction is.
And all you do is step on the pedal?
Step on the pedal and look at this. Whoa.
Oh my God, that is good.
And you can see the clots are literally like, you can feel the suction. And we've done this with super suction and other things. This is stronger and this is very good suctioning out everything. And you can see and we could push the scope back in once we move it to actually access and visualize the bleeding source to treat it.
And you can potentially do whatever the intervention that you need right there and then.
Yeah, and you could even take out the scope and leave the overtube so that you could use the entire full 14 millimeter diameter to get even more suction if there's lots more bleeding blindly, but you're already in the source. And then you could go back through the already placed overtube with the scope again to stabilize the bleeding.
I think it's so important to be able to visualize, and I know you're honing on that, the source of bleeding right there and then, because a lot of the times you stand there, you suction, it bleeds, and then it stops, and then you lost it.
Yeah.
Because you're just changing the scopes and doing this and that,
right.
and then the opportunity is gone.
Exactly. Every second counts in this very critical situation as the patient is actively bleeding, and this overtube clot remover is very strong, very helpful, and it's very safe.
Yes. Well, thank you so much. That was beautifully done.